I really liked the government initiative last year with African ExCon to be a gate for innovation in Africa. And that started very well last year with a great step into networking. So many stakeholders met each other last year, lots of learnings, and I think this will happen again this year. And I think the continent needs that kind of dynamic interaction between the different countries, focusing on innovation to bring more sustainability and more solutions to the different countries in the continent. This year, I'm really hopeful that the conference will take a step forward towards meeting the objective of being a gate for more innovation. In Roche Egypt, we are determined to continue our journey towards our ambition, 10 years ambition, which is bringing more innovation to more Egyptian patients at less cost to the society. And the way we are doing this is we're tackling important files in the healthcare system in Egypt. Important problems needs to be solved. We started that with an example, breast cancer, and I'm happy with our contribution. So we're willing to continue that in the future, and in parallel to solve even bigger problem like the most prevalent type of cancer in Egypt. Now we're starting a similar journey in the liver cancer. In parallel, we're bringing more innovation in different disease areas. One example of that is in the ophthalmology area, where we have almost 1 million patients. At the healthcare system level, we're very keen to partner with different parts of the healthcare system to lift up the capabilities and the infrastructure to fit for the future. We're happy to play that role now and in the future.
We have a saying in Africa, if you want to go fast, go alone. If you want to go far, go with others. We want to go far in Africa by focusing and contributing to a better infrastructure, capabilities development, resilience healthcare system, and better patient journey. We appreciate the efforts done by the Africa Health ExCon to gather more than 75 countries all over the world under one roof to realize the vision of making Egypt the gate of innovation in Africa. And it's an opportunity for knowledge transfer and share learnings across the African continent, as well ensure equitable access to health technologies for all African patients. The African continent carries 25% of global health burden, with 1% global health budget and 3% global health workforce. Early diagnosis is key and critical for the African population. At Roche, we have the aspiration to ensure health for every African. We adopted an ambitious 10-year strategy to increase access to high medical value tests by tenfold. Roche Diagnostics is taking a long-term, sustainable approach to expand access to diagnostics and universal healthcare services with partnerships with the public and the private sector. Roche Diagnostics' track record in partnership with the Egyptian government in several projects, such as HCV elimination program and breast cancer screening, has demonstrated that fast change is possible and impact is tremendous.